I am Dr. Archana, consultant gynecologist. My work is based on intralipid in cases of recurrent miscarriage that I have worked in my clinic at Delhi. Previously, I worked in NHS St. George's, and now I am based in Delhi. Everyone knows how devastating miscarriage is in women's life. If pregnancy is lost before 24 weeks, that is called miscarriage, and if it is happening again and again, that is called recurrent miscarriage. Whenever a couple comes with positive pregnancy test, we know how happy they are, and that is the moment of celebration for them. And suppose that pregnancy is lost, they become sad, they seek help of doctor, and when they come to gynecologist, we don't have anything to help them. That time pregnancy is already lost. We say, okay, go and try again, you will conceive again, and nothing will happen again. Again they conceive, and sometimes they miscarry again. Then the disaster happens. They come to the gynecologist. We say few words, send them again, and we run few tests, and they are also helpless. We don't have any definitive treatment at moment. Slide is not running. Is it not moving? At moment, the incidence of miscarriage is 10 to 50% of women of reproductive age, and out of them, 1% is recurrent miscarriage. How much they are impacting the lady's life? First thing is emotional. They are emotionally depressed, sad. Family is also depressed. Financial, they have to undergo dilatation and evacuation. Social burden, sometimes their married life is at threat. Husband saying that divorce is impending. So there is no available treatment at present. Can be a traumatic experience, undergoing dilatation and evacuation, leading to excessive bleeding. They have to undergo blood transfusion. Curettage gives rise to synechia formation, infertility later on. My work is based on recurrent miscarriage. Can you move the slide? It's not moving. Not moving. Yeah, no. Okay, so now what are the causes of recurrent miscarriage? Chromosomal abnormalities is said to be most common cause, and that is also for sporadic miscarriage, one-off. They will not have again and again. Antiphospholipid syndrome, SLE, hormonal imbalance, such as uncontrolled diabetes mellitus, hypothyroidism, uterine malformation, septate uterus, etc. My work is based on immunological, where there are a high number of natural killer cells attacking the embryos. What happens? That pregnancy contains paternal DNA as well. Women womb lining, endometrium, attacks them thinking that they are foreigner to us. So I have worked on this cause of miscarriage. What are the investigations available? When they come with history of recurrent miscarriage, we advise them to undergo few investigations like ultrasound, hormonal profile test, some blood tests to diagnose antiphospholipid syndrome, chromosomal genetic testing. Sorry for the inconvenience. And sometimes we have to do chromosomal analysis of the RPOC as well. Yeah. Investigations, they have to undergo. We advise ultrasonography, chromosomal and test, hormonal test, karyotyping of both partners, karyotyping of product of conception, thrombophilia screening, that is also very cumbersome and very costly test, natural killer cells test in the blood and endometrium. In the blood, it is also not very sensitive, any specific test. Endometrium, you have to test for natural killer cell. Then you have to take endometrial biopsy. Not very easy to the patient. Usually they come to us after exhausting all their money and energy and hopes. So at present, what we are offering, aspirin, low molecular weight heparin, corticosteroids, progestogens, intralipid in IVF setting. At present, intralipid is being given in IVF settings only, where they are giving 3 doses of intralipid pre-implantation, after implantation, and when first pregnancy test positive comes. And LIT is another mode of therapy, genetic screening, IVIG, intravenous immunoglobulin, that is also very expensive test. And sometimes we don't have anything just to support her. My work is based on intralipid. So how it all started? In December 2019, I had a patient, 33-year-old. She was nulliparous, no issue. She had history of 3 miscarriages. She had exhausted all her finances, all her energy. She came to me emotionally depressed, hopeless, and she said, everything was done in the last pregnancy. Doctor, if you have something to offer me, please advise. And so that gave me a brainstorming challenge. I started researching literature, podcasts, YouTubes, and all the journals. And I heard they mentioned about intralipid, a fat emulsion that can be given intravenously, and that gives rise to high success rate. I found this literature in a paper of Center of Human Reproduction, and they give intralipid in IVF setting. Until now, the therapy is being used in large-scale IVF center in cases of recurrent implantation failure. I thought, why not is going to help my patient? First, I counseled the patient. I asked any side effect, any reaction, I advised her. And she got ready to get this therapy. In 2019 December, I gave her intralipid therapy. I was very scared that time. Will there be any reaction, adverse reaction, any teratogenic effect? And with all uncertainty, I kept all the emergency medicine with me. I administered her intralipid, and next 4 weeks, she conveyed me that I have got positive pregnancy test. I thought, okay, we will do ultrasound after 6 weeks. That has also positive indication. Fetal heartbeat was detected. After 7 weeks, ultrasound was okay, and 12 weeks ultrasound was also normal. She delivered at 9 months, live birth, successful live birth. That gave me a boost, game changer, and that encouraged me. I started giving intralipid to all the patients who ever coming to me for recurrent miscarriage, where all the other causes of miscarriage was excluded. So far, I have given intralipid to 74 patients. Out of them, 40 conceived within 8 weeks, live births in 39, ongoing pregnancies 4, miscarriage happened in 1, and rest of them, they are not responding, and someone, they didn't conceive. My study was affected by COVID as well, because 2021, I could not give to many patients. So question is, what are intralipids? Well known to our medical faculties. For me, it was a new medicine, so I studied a lot. Intralipids are intravenous lipid emulsion, invented in 1962. It is made up of soya milk, egg protein, egg white, glycerin, and water. It includes linoleic, alpha-linoleic acid. And so far, where intralipids being used, it is used in total parenteral nutrition, where patients can eat and drink in terminally ill patients. And another use is toxicity of local anesthetics. It is a life-saving medicine for local anesthesia toxicity. And in IVF setting, in recurrent implantation failure. Next question is, how do we administer? Usually it is available in 100 ml of bottle. I am diluting it in 300 ml of saline, making it total 400 ml, and administrating very slowly in 4 hours. Usually I am giving single dose, and it is very cost effective. One bottle of intralipid is available in around 300 rupees in India. Prior consent, usually I take. All the side effects I explain to the patient. History of allergy, egg yolk, soya was taken because it is made up of soya and egg yolk. So what are the different contraindications? These are the contraindications where it should not be given. How does it work? Usually it is effective in immunological miscarriages, where there is hyperactivity of natural killer cells, and it works through the mediator of inflammatory cells. So nutshell, intralipids deactivates natural killer cells in women's body. Recently, one of my patients delivered after 9 months of pregnancy. She had 5 miscarriages. She was hopeless. Last year, November, she came to me for consultation. Doctor, do we have any treatment for miscarriage? Because last 5 pregnancies, I have tried everything. I have been seen by many gynecologists, and nothing is working. Should I try another pregnancy, or should I go for IVF? I said, wait, I will give you intralipid, you will see the result. And luckily, she conceived in the same cycle when I gave intralipid, and she delivered recently. Please see the video. Sound is not coming? Video sound? Sorry. So the lady has given me testimonial video. Sound. Sound is not coming of the video.
हेलो, मैं राधिका शर्मा दिल्ली से। मेरी शादी को 5 साल हो गए थे। मुझे मल्टीपल मिसकैरेज का इशू था। फिर मैंने बीजी क्लिनिक विजिट किया, जहाँ पे डॉक्टर अर्चना मैम ने मुझे इंटरलिपिड के लिए सजेस्ट किया। फर्स्ट साइकिल, फर्स्ट डोज में ही मैंने बेबी को कंसीव।
I'm very sorry for that. I have recorded the sound as well.
हेलो, मैं राधिका शर्मा दिल्ली से। मेरी शादी को 5 साल ने मुझे इंटरलिपिड फर्स्ट डोज में ही मैंने बेबी को कंसीव कर लिया, और आफ्टर 9 मंथ्स मेरी सक्सेसफुल डिलीवरी।
Okay, this is my another patient who had also
कैरेज हुआ
conceived
और
after
इसके बाद एक और
interlipid
कैरेज हुआ।
therapy
उसके बाद
and
में
she
डॉक्टर
had a
अर्चना।
baby 1 year ago. She was also very happy after
हेलो,
the
मैं
baby.
राधिका शर्मा दिल्ली से। मेरी शादी को 5 साल हो गए थे। मुझे मल्टीपल मिसकैरेज का
Okay,
इशू था।
subtitle is there.
फिर
Okay. So I will conclude my talk. In our part of the world, many patients do not have access to basic health care. They can't undergo sophisticated investigations. Treatment options are beyond their reach. Intralipid therapy is extremely cost-effective approach. Additionally, it has got no side effect, is very easy to administer. Compliance is also high. We have seen very encouraging results. To further validate our results, multicentric trials should be done, and it should be given to more and more patients so we can have better results and better data. Acknowledgement and references mainly taken from Royal College of Green Top Guideline, and special thanks for audience for listening. Any critical analysis or feedback? Because this is my own study, I want in feedback. Any question? Okay, thank you.